Ready? Okay. How many of you are aware that chemical castration, used as a form of punishment for sexual offenses, is actually legal and mandated in 7 states in the United States? I was unaware of this until I began to research for this project and speech. Along with states such as California, Florida, Montana, and Wisconsin, several other countries have legal mandates for chemical castration for punishment of sexual offenders. It would surprise you also to know one of the biggest advocates for chemical castration is a sex offender himself, Joseph Frank Smith, who was convicted of child molestation in the 1980s. He went under chemical castration, but 10 years later decided to stop his treatments and was once again convicted of molesting a 5-year-old child. So if it's proven to be effective in reducing offending of sexual predators, why is it not mandated more in the United States? What is chemical castration and what does it do? According to the Cleveland Clinic, chemical castration, sometimes called medical castration, refers to the use of chemicals and drugs to stop hormone production. By reducing the levels of testosterone, you suppress a man's sex drive, therefore reducing his sexual urges. Chemical castration has been proven to be safe and humane and is in fact used in some cancer treatments. Let's look at a few statistics and studies of chemical castration effectiveness. The National Library of Medicine states that chemical castration and associated decrease in serum T levels, testosterone levels, reduce the frequency and intensity of sexual thoughts in 76 and 71% of Group A patients and 78 and 72% of Group B patients. Reductions in masturbation frequency were observed in 74% of Group A and 83% of Group B patients. So what does that all mean? It means in both studies with all patients, over 70% experienced a reduced desire for sexual urges. So it decreased their sexual urges. So that's a significant drop. In 1991, a Johns Hopkins study showed that less than 10% of 626 chemically castrated patients had committed sexual offenses 5 years after the treatment. Again, 10% of 626, 62 out of 626 patients did not reoffend in the next 5 years. Based on additional studies, reoffending rates for a second sexual offense is just around 2% compared to 40% of people who don't undergo chemical castration. 2% compared to 40%. So we know it's effective. While chemical castration can be effective alone in the decrease of reoffending, a lack of hormones is not foolproof. Therefore, the addition of therapy to deal with cognitive disorders that don't deal with the hormones that result in sexual abuse must be offered. It serves as a second tier of prevention. Preliminary evidence suggests that treatment using cognitive behavioral therapies decreases subsequent offending. According to the U.S. Department of Justice, certain components are included in almost all cognitive behavioral interventions for sex offenders. These include treatment of cognitive distortions, the teaching of empathy and social skills, and the implementation of emotional management and relapse prevention. Now we're going to have the argument by some that this is taking away a criminal's rights and can inflict medical issues later on, like osteoporosis. But as a victim of child molestation, who watched my sister also be victimized by a reoffender, I can tell you that our rights were not taken into consideration by an abuser. We lived with a guilt and shame that was not our burden to carry, and we lived with a distrust of the judicial system and our parental figures. And we carry this around. So when it comes to empathy for sexual deviants, I have no empathy. They are due what they are due. So while chemical castration in conjunction with behavioral therapy will not entirely eliminate the issue of sexual predators and sexual offenses, it is a humane and safe way to get better control of those who cannot control themselves. With the continued legal practice and mandates of chemical castration as a form of punishment for sexual offenses, we can do further research that will lead to better statistics on the effectiveness of chemical castration and hopefully lead to the implementation implementation of mandates across the United States and other countries. My name is Elizabeth Kane. This is speech 3 for COM131.